What does a pharmacist do? Well, most people might answer that a pharmacist dispenses the medications that my doctor prescribes. Now, I work with a ton of great pharmacists, and one thing that I don't generally see is excitement about pills in a vial. And this is probably because pharmacists have been trained to do so much more. So what can you get excited about in your community? To find out, let's go beyond the scripts. Hey, I'm Will Tuft with Beyond the Scripts. Thanks for tuning in. Today, we have a great episode. I want to kind of talk about some things that have been going on over the past year, 2 years now. Those 2 years have really flown by, but there have been a lot of distractions with COVID and the adaptations that independent pharmacies have had to make to kind of meet the needs of this kind of unprecedented climate that we're in, but then also, really adapt to those patient needs during this time and providing all of those immunizations. A lot has changed, but a lot has stayed the same. So, it's just like in school when I wanted to take on those extracurricular activities and my parents were reminding me, hey, there's still those grades accumulating in the background. It's really important that we stay focused on some of those metrics that have not gone anywhere, have not changed, and even new metrics have been added. So today, I want to bring in a special guest from Germ's Thrifty Clinic Pharmacy down in Opelousas, Louisiana, Germaine Robinson. Thanks for joining us today.
Thanks, Will. I appreciate you guys asking me to be here. And peace to everyone at Pioneer. You guys are top notch.
Awesome. Yeah, you've been with Pioneer for a little bit, huh?
Yeah, 2017.
Nice. So before we talk about Germ's pharmacy and where you're at now, let's talk a little bit about where you came from. I think that's always kind of interesting to see, like, the experiences that pharmacists have had that kind of shapes what they're passionate about now. So where'd you come from before you had your own pharmacy?
Well, I was born and raised in Church Point, Louisiana, which is a little ways from Lafayette, not very far. Cajun country, we should say. Grew up with French-speaking parents. Myself learned to speak French. Throughout my career, I've done hospital, mental health, compounding, worked for the VA administration, just been around everywhere, chain pharmacies, and ended up in independent pharmacy, which has been a blessing. So I've pretty much been everywhere and done it all. But being an independent is just a great thing. I'm in Opelousas, everybody's family. When they leave, we love you. It's just an amazing experience, especially that I'm with them more than I'm with my family. So good. We have a good rapport. Everybody's wonderful.
Yeah, we had Joelle Fruget on recently, and
pharmacy school with Joelle Fruget.
But
friends. For me to come after him and do this podcast, because hands down, he was terrific. He was just great.
Yeah, he's a neat guy. But he also kind of, right there in your neighborhood down in South Louisiana, same kind of cultural vibe down there. A little bit different than the kind of culture we have here in Shreveport, Louisiana. We always try to kind of identify with the cooler, like, Louisiana culture that you guys have down there. But he also kind of echoed some of that same sentiment about, that tie to the pharmacy and your employees and your kind of community feel there.
I was actually off a couple of days last week, and I'm in a doctor's office. I'm in the middle of, I have a doctor on one side and nurse practitioners on the other side. And I was only gone for a couple of days, and the doctor next door to me was like, "Oh my God, you're back." And I'm like, I was just gone for 2 days. It's like, whoa. But I hadn't had a day off since November of last year. Other than the weekend. It's just myself and a technician had been working. I just recently got a new pharmacist. Yay. Part-time. So I'm excited. I'm very excited. And she's a Pharm D. Her name's Megan Guidry. And great things are going to happen. Yeah.
That's awesome. That's awesome. That's one of the things I was going to mention is that, a lot of pharmacies have, those really close knit teams where, the technicians, especially in independent pharmacies, play such a larger role than, what the definition of technician might be, whereas the definition of a technician may be much more of a, interchangeable part. It really seems like independent pharmacies, and especially some of the independent pharmacies in that area, really the technicians become a more integral part of the fabric of that pharmacy. So, your technician, for example, I've seen that she appears on your billboards and on your in your interviews right there with you.
She is Ma Marine of the pharmacy. She is frontline, and all technicians are frontline. By all means, we could not do it without them. We don't even have a cashier. It was just Nikki. Her name's Nikki Phillips, by the way, and a big clap for her. We are a cashier. We are, take out the trash, mop the floor, you name it, answer the phone. And still at the end of the day, everything's done, we're able to do the job. But she, hands down, has just taken it upon herself to come in and just roll with the punches. And you tell her once and she's got it down to the science.
It's definitely kind of a an atmosphere that like it has to kind of transcend the job title. There's really no room in independent pharmacy for anyone to ever be like, that's not my job. It seems like whatever we can, we do, and that's such a cool part of that. So glad to hear you're adding to that team and expanding that.
Yes.
So tell me a little bit about Germ's Pharmacy. Love the name.
It takes a while for people to get it once I say, well, my name's Germaine. Oh, okay. Now, it's like an epiphany. Yeah. So I just had to throw that in there. I have a brother whose name's Barry, 2 sisters, one's Bonnie, one's Susie, and I don't know, my mom came up with Germaine. That was a bit of a stretch, but I was named after a nun.
Nice.
Sister Germaine or Mother Germaine, I'm not quite sure.
So, did you come into that pharmacy as like an existing community pharmacy?
Yeah.
Or is that one you started? Okay, so tell me a little bit about that.
Yeah. The person I bought it from had another pharmacy, and he just couldn't do 2 pharmacies anymore. I was doing relief for him, and it was just a perfect opportunity and perfect timing for me as well. So I took it over. They were doing some things that wasn't what I would do. So we changed up a bunch of stuff. And I came from, prior to that, one of the big chain pharmacies, which back in, I guess 2008 or 9, we learned how to do MTMs at that point. So they already knew this is coming down the pipe. And that's a long time ago. So they were well ahead of the game. And I had the perfect boss. Her name's Paula Bell. I think everybody knows Paula Bell. She was an excellent mentor. So whenever I took over the pharmacy, she's like, hey, you need to get in with the equip, start doing your MTMs and everything. So immediately I started doing all of that, following that, which I didn't know too much. Oh, and by the way, she said, and you need Pioneer.
Nice plug.
Yes. So immediately I had another software, and I'm like, yep, first things first. So I got Pioneer going, and then I think my PSAO at the time was somebody different than who I have now, Pharmacy First, which they've been great with helping me getting started with the equip. I also met up with Tori Pearson from Medicine on Time, which that just set me on a whole new goal because the adherence was not there. I mean, I don't even know if I was even on a star rating. I think I might have been negative, really, when I took over. So with the help of Tori, she introduced me to PSAO, and I forget who was working at the time. They're no longer there. Now it's Dalton. I'm talking a lot with. Um, from there, she also hooked me up with Brittany Boyd with PQS, and we sat on a conference call, and Brittany broke down the trimester report, which I had been throwing away because I'm like, they're taking my money, whatever, filing it. She's like, no, you can do stuff. So with the help of Medicine on Time and Pharmacy First, they put me on a pilot program. So I took all the outliers from the eQuip dashboard and started packaging these patients. And just from that, my score started going up. Then Brittany had explained to me some other things, which I wasn't even noticing on the dashboard. Started working with that, figuring out what insurances were affecting us. So as with Pioneer's excellent reporting, I was able to pull those insurance companies, get those outliers from there, and focus on them instead of trying to focus on everybody. I pinpointed it to exactly who was on that trimester report. And lo and behold, the next thing you know, my scores on my trimester reports were amazing. It's just, I know they're going to take money from me no matter what, but if you can get to the bottom of that variable range, if it's 12 or 17%, hey, you're just going to get 12. You're not going to get the 17,
Yeah. So, okay, you just unpacked a lot of information, and anybody within like the pharmacy atmosphere is going to understand that. One thing I love about this podcast is that a lot of people who aren't necessarily familiar with all of the ins and outs of pharmacy billing and ratings and all of these things sometimes find their way to this podcast. So can you kind of explain what happened? So it sounds like you went into this existing pharmacy. You said, hey, I see some ways to improve. So if the previous owner sold that, obviously they were struggling in some areas, whether it was management or profitability or just being overextended. So you saw some areas to improve, probably operationally, but it sounds like you really focused in on some metrics. So you mentioned PQA and you mentioned scores. So briefly kind of summarize what scores. Is that 5-star ratings, and how does that work, and why did those come about?
Yeah, well, and doctors need to get on board too, because it's been tried with us, and now it's going to affect them. Well, actually, Pioneer, on your dashboard, as you're filling prescriptions, you can look and see what percentage of the time these medicines are being filled. We focus on your statins, your ARBs, ACEs, and your diabetes medicine. That's what we were focusing on at first, to make sure that they were compliant. You don't want to see anybody come in and, hey, they're 100% on their pain medication, but 60% on their cholesterol medication, diabetes medication, So, following Pioneer, and that's what the eQuip dashboard is all about. They're letting you know, hey, these people are failing. They're not adherent, and that's what's affecting your bottom line, your reimbursements. So I just, worked with that, ran reports, and now it's really once a week, Nick will run a report, make sure, hey, yep, everybody's already, we have them, pretty much a lot of them med synced.
Yeah.
That's a no-brainer, and I even did an MTM the other day for a person. They paid me $30 just to med sync them.
Yeah.
Hey, perfect opportunity for me to start packaging this patient's medicine,
Yeah, well, that's the key. If we rolled out Medicare Part D, it's going to save the healthcare landscape a lot of money if you can be proactive, if you can focus on that preventative care. So we see that rolling out, and then we see, hey, we need to find ways to keep people accountable, or use a carrot and a stick and keep these patients taking their medications. And you mentioned those therapeutic classes that are those priority therapeutic classes, diabetes, hypertension, and cholesterol. Those are the big ones that are going to keep people out of the hospital.
Correct, especially in this day and age of COVID.
Yeah.
You need to stay on top of your disease states because it is what it is.
Yeah, yeah. And so I imagine if you're, not going, if all of your routines have changed over the past year or two, I imagine adherence is also going to be one of those routines that may suffer. So PQA has the standards that they've set. You need to take a medication blank percent of the time, 80%, whatever, for it to be effective. And so they have some metrics. They use the PDC,
yes,
which is proportion of days covered. And then Pioneer has the PDC and also like the NPR. So, when you do have a patient who's coming into your pharmacy, you're filling their prescriptions. How do you go about keeping an eye on that? Because while you're filling and billing, it's kind of hard to just look at, are you taking every medication all of the time? Like how are you actually keeping up with that during workflow and, realistically and not just theoretically?
Well, when they call in for, let's just say they'll call in, I need rosuvastatin filled or anything. We're on top of it. We're already looking at their profile. Well, hey, you got your metformin that same day. You should be out of that as well. And so, oh yeah, I only have 2 or 3 left. So we really try to keep them all in sync, encourage them. And I mean, I'm just as guilty. However, I package my medicines now because I'm not compliant. So I can't practice unless I'm, preach it unless I'm practicing it. So that packaging works and I understand I'm a lot younger than a lot of my patients, but I'll walk away and go back and I'm like, did I take it or did I think I took it?
Right.
When it's in a bottle, however, when it's packaged, I've got the day and the date on it. No, I just thought about it. So let me pop open that Monday's package or whatever and take my medicine. But on refills, we try to catch them when they call in for them, and
nice.
Proactiveness. You talk to them. And not only that, and I guess we forget, but we really need to talk to them about their diet. That makes a big difference. We're not just there to dispense, we're healthcare providers. So, I try to encourage them. I had a lady who was a newfound diabetic. And she's like, but, I don't eat sweets. And they automatically put her on insulin. So I had to teach her how to use insulin because that particular office didn't teach her. She's like, I don't understand. I don't eat sweets. I was like, well, it's South Louisiana now. I said, but do you eat rice and potatoes? Do you like beer? And she's like, oh, yeah, I like my beer. And I was like, oh, and my rice and my potatoes. So I had to explain to her, it's not just that sweet tooth. We've got to cut back on carbs or watch what carbs we eat and intake. But she was like, wow, I didn't know that.
Well, that's an important thing to note is that, culturally, geographically even, that's going to have a huge bearing on some of those social determinants. So like if I'm going down south Louisiana, I'm going to pull off on I-49 because there's a butcher shop in Opelousas that has fried pork chops that are just amazing.
Everything, the cracklings. I mean, come on, boudin. It's hell to lose weight around here, but
yeah,
that's why I walk.
Yeah, South Louisiana, it's definitely. I wouldn't describe it as a paleo diet or a super health conscious diet. It's very tasty food, but probably presents its own social determinants. If you live in South Louisiana, you're probably enjoying a lot of that great. Although somewhat unhealthy cuisine.
And it's nothing for us to have rice and gravy with potatoes. Yeah. We'll have a potato salad or whatever, some other potatoes. It's like, wow, yeah. It's tough. And my husband's an excellent cook. Oh my goodness. So it's really tough.
Yeah, yeah. So when you look at a patient's profile, one thing that I thought was really interesting is you said if you're taking in a refill, you're not just acting like short order cook, throwing it in a queue. You're actually taking a couple seconds, and really with Pioneer, you have all of the information there to do almost like really quick, um, medication reviews while you're on the phone with that patient.
Absolutely. I mean, we do that. I mean, I take blood pressure checks and do e-care plans. I was actually on, I am with CPSN doing Flip the Pharmacy. And from that, I actually got a private payer for a year
Yeah.
doing e-care plans for opiate assessment.
Oh, wow.
Yeah, that was a great experience. So I didn't drop the ball. I'm still doing it. It just becomes part of your game plan, which is
Yeah.
a good thing. It really is.
Yeah. I mean, that's really the key. If it's not part of your game plan, if it's not integrated into your workflow, if it's not just what you do, if it's something you go back and do later, it's real easy for later to get later and later.
That's correct. That's correct. It'll pile up. But I mean, you just get into a routine, and when you have that great workflow, and once you have it established, it's just second nature. It's just part of your daily routine. And look, if Nikki and I could do it alone and be 5 stars, you just have to have the right people in the right place. I
Yeah.
see a lot of pharmacies that have a lot of staff, and you've got to have one person in there that can do all of this. And I'm not a high volume like, some stores, but they have more employees than I do. So there's a way to incorporate someone in there. You just find that right person and get them going. And once you do, it's amazing. It just works itself out.
Yeah. So it sounds like you're really just being conscious of specific metrics that you know are affecting your store's ratings. You mentioned 5 star. So what is being a 5 star pharmacy mean? And then how does that affect your pharmacy, like from a business standpoint?
Well, your reimbursements are at its best. Your score, that means you're keeping up with your outliers. And again, it goes back to the EQIP dashboard. They give you a percentage where you need your patients to be. And once I got with the program, figured it all out, and which took a little while, it's on autopilot now. So pretty much it works itself out. We're 5 stars. Reimbursements are at the best it can be. Unfortunately, they still take money from you, but hey, that means your
Yeah.
adherence is great. My patients are doing good, which makes me feel good because at the end of the day, it's about them.
Yeah. So it's interesting. You can take something that seems incredibly sterile, looking at your, statistics across your pharmacy, that sounds somewhat higher level and removed from, how that patient is doing. But really, if you look across the board, PQA has set those standards so that, you're being rated on the effectiveness of your care. If a patient's not taking their medication 80% of the time, then that medication is not going to be effective. They're going to end up in the hospital. So, it really does come down to, that ground floor of, really providing that care for your patients and helping improve their life. So, what are the steps? Because I know there's a lot of pharmacies out there that are hoping they're doing everything right, but maybe they're not actually checking up on their equip scores.
Well, and also, if a patient's not compliant, let's say on metformin, and we're not keeping up with it, or they're going to go to the doctor's going to think they're taking this metformin, so now they're going to put them on Januvia. Well, personally, I want to make sure they're taking their metformin because I don't want to have to fill Januvia and lose $35. Because at the end of the day, that's what they're doing. Brand name drugs, we are not getting reimbursed the cost of the medication. It's a challenge. So again, these doctors assume they're taking the metformin, but their A1C is still high, but they're not taking it. So why put them on Januvia? How about let's get to that bottom line? So if you're making sure they're taking, glipizide, whatever.
Yeah, I mean that's really the key. If the patient's not taking their medication, they go back to the doctor. The doctor says, "Are you taking your medication?" They're like, "Oh yeah, every day, twice, twice a day when necessary." Like,
and I'm not eating cracklins and Buddha either.
Right, switch to all salad stock. Didn't happen. So you're right. That's just going to complicate their medication regimens because the doctor is going to say, okay, we need to try something else. We're going to introduce something else. And it can kind of snowball. But again, you mentioned doing those labs. So even if the patient picks up their medications, if they tell you they're taking it and they're just accumulating on the countertop, you're actually going to find that you're going to see the report card,
Yeah, and they're quick to tell me the truth. Oh no, I have plenty metformin. Well, but if you're running out of your cholesterol medicine and you filled it on the same day, so they end up having to confess, well, I'm really not taking it like I should. Well, then my suggestion to them is, how about I package it? All in the same square. You'll take it. You won't forget. It works beautifully.
Yeah. So adherence packaging is something that, was really kind of introduced to the public in a bigger way in the past couple years with Amazon's pill pack. A lot of regular consumers who are maybe, not familiar with the options that are out there from independent pharmacy, saw a pill pack and they said, wow, this is so cool. And, I was telling friends of mine, I'm like, there's an independent pharmacy up the road from you that offers that service and will do it far better because they're able to sync your medications for you. They're able to, get those short fills, which you can't do on pill pack. It's such an amazing service. It was kind of underappreciated from independents. So I think that's the neat thing that came from all of that. I don't think too many independent pharmacies lost patients over it so much as gained awareness of what's out there and we can do this better.
Yeah, because we have such a rapport with the physicians. I mean, we can get on the horn, get a nurse. Hey, this person wants to package their medicines. And this is what I really love about it is you don't have to wait 10 days for a refill. Because when I say, look, I package their medicines, I need to package it like today or tomorrow. I need that refill.
Yeah.
They're like, okay. And especially now that they're going to be graded as well, these physicians on medicine adherence, it's there. You're not waiting for refills, It's great for pharmacy and for the physicians.
Yeah. So that's the other side of it is that, you're going through the extra steps, you're really paying attention to that patient's profile. You're giving them their medication on time and adherence packaging, medication on time. So, yeah. See what I did there? All right. So the doctors have to love that because you're also doing that follow-up. You're getting those lab results. You're improving your ratings, which is in turn improving your reimbursements. But physicians are also being hit with, various metrics that they need to improve. So just by the nature of you being on top of your game and excellent, are your physicians recognizing that? Are they seeing benefits from that?
Not yet. They're still in denial, but
yeah.
When it hits them, then they're going to say, well, look, all my patients from germs are doing great.
Yeah. It does take a while too, for those records to
Yeah, because
cycle.
we're still just finding out about reimbursements from 2020. Come on, we're about to be 2022. So you really need to get in the game now for your 2022 scores, because we're already in 2021. You already missed the boat if you're not doing anything yet. So you already missed the year 2021.
Yeah.
So now's the time to jump on board and let's start working on that.
So can you explain kind of how that affects your reimbursements? Like what third parties are looking at what scores and how does that directly affect your reimbursements?
Just about all third parties now. Not your private insurance yet, but it's coming down. It will. I'm pretty sure it will. You've even got Medicaid plans that are doing it. Optum, and of course, you've got CVS, Caremark, who owns half of them. WellCare, Aetna. You really need to look at them all and see who's on those medications and just find your bin number for those. Look at your trimester report. That right there, work on that. Find those insurance companies, get your bin numbers, run a report of whose patients or what Medicare patients are on these, and see who's on your three classes, and put them on a program. Run a report weekly. You get new patients all the time too, so you want to make sure you're not missing those. Because that's what's bad. You'll inherit a patient from another pharmacy who's not compliant. Well, now that brings your scores down, which is not fair, and I can't explain why that is, but it is. It is. So yeah, and that's happened to me quite a bit. I'm like, oh, bro, here we go. But I just give them a little speech. Hey, if you want to fill with me, you're going to have to be compliant, and And again, and I hate to use the COVID thing, but if you're not compliant, you're not taking care of yourself. You have to,
Yeah.
They're not putting you on these medicines just for the hell of it. I have to remind myself to take mine because, I have high blood pressure, high cholesterol, and all that good stuff. It's just, we've got to take care of ourselves.
Yeah. So it sounds like you also take an interesting approach that definitely is something that maybe is easier to do, or maybe more, maybe people feel more comfortable in a small community where you have that connection. But it sounds like you really put some accountability onto your patients as well.
I sure do. They put it on me and I put it back on them. It's a two-way street. But at the end of the day, I'm telling you, we're like family, because we'll argue. We will. But we love each other at the end of the day. It's all good. We spat, but they know I'm right. They're like, I'm sorry, Miss Germ.
Yeah. Well, that's really that accountability is so important, because it's real easy, especially, if I can only imagine, taking 10 different medications and being, maybe an elderly position, maybe you could really use some assistance anyway. So just that, keeping up with those multiple medications, you end up with a couple on your dresser, a couple in the kitchen cabinet, 2 on the bathroom counter, one.
And it goes back to, did I take, and for the elderly, especially with those with caregivers, this, packaging is the best thing. They can just, like, especially with medicine on time, it's the month package, but each little square is perforated. So for my mom, for instance, my sister will take off her morning pack and bring it to her, and her evening pack and bring it to her, because she does have dementia. So it's there, and my sister as well. It's like we forget, but the date's on it, her name's on it, the time of it. This is her 8 a.m. dose pack. This is her 8 p.m. whatever. So for caregivers especially. We work all the time. Now we are having to take care of our parents, or, so for those working people, it's the best thing for them. It really is, if they're having to take care of the elderly. Because I cannot stand to fill a pill box. That's why I package my medicines. Come Sunday, I would be depressed because, oh, I have to go fill my pill box. No.
Yeah, I love that that pillbox mention because I was in a pharmacy that hadn't implemented MedSync yet. And they were just filling every prescription as they came in, which is horribly inefficient. You know, if you get twice as many prescriptions in your store, you're going to need twice as many technicians because there's no economy of scale. It's such an inefficient way to work on top of, all the clinical issues that brings. But they were resistant for MedSync. They were like, oh, our patients don't want that because it's hard. It's hard to change. It's hard to implement a new process. But while I was in that pharmacy, somebody came up to the counter with one of those plastic 7-day pill organizers. And well, no, they bought it off the rack there. They bought it to do it themselves. And I'm like, your patients want MedSync. They want adherence packaging so bad they're going to do it themselves.
Absolutely. Absolutely. And okay, so if you're not MedSynced and they have their little pill box filled, well, or they're going to fill it on Sunday or whatever for the next week, but they only have 3 pills in one bottle, that's hard to keep up for them.
Yeah. Yeah.
Do they put those 3 pills in and then they get it refilled in them? Okay, which ones do they need to go in now? Or do they not put the 3 pills in and then they forget that whole week to take their cholesterol medicine or their diabetes medicine because it's not in the box?
Yeah, or do the patients need to sync themselves through non-adherence? So if I'm going to start using this pill box, well, I'm just going to take my metformin every other day so I can make it to Friday so I can get them all filled at the same time. It really poses a lot of problems.
It does. And the beautiful thing about the packaging as well is, especially with Medicine on Time, at the very bottom, you have the IDs. I mean, it has a picture of the drugs, of each drug in the package. So let's just say, doc told me to stop taking this one. Okay, well, look, this is it. When you go to take your evening dose, pull that one out. Now, if it's something I just, packaged, I'll repackage it for them. But if it's, they have a week left, they know what pill to take out and not take.
Yeah.
It's a beautiful thing.
Yeah. So we're kind of talking about 2 different things, but they definitely go hand in hand. So medication synchronization is basically, hey, I'm going to sit down with my patient. You have 10 medications. You got one from your cardiologist, one from your general practitioner, one from your therapist, and they're all due on different days. I'm going to sync those together. So you come to the pharmacy once a month. I have all your medications ready in an appointment-based model. And then that really sets the stage to let me make it even easier for you. I'm going to put those in adherence packaging. So every day you have your doses lined out for you. So you mentioned Medicine on Time. That's the adherence packaging that you're using. There's a lot of different formats out there. So strip packaging, where they look like little packages of runts that are put together. You have your blister cards. You have some envelopes. I mean, there's a lot of different adherence packaging out there. So tell me a little bit about the option that you use. Is that a manual option? Is it automated? How does that work?
Well, it's manual. I do it, but it's interfaced with Pioneer because I do have Pioneer. It's interfaced with Pioneer. So I have a different system for Medicine on Time that prints the labels for me. And it's just little plastic dose cups in a square. You have a standard capacity, like if they're only taking 5 pills in the morning, you will use a smaller dose pack. Or you have the high capacity, which I have patients that are on like 20 meds. So I'll have to use that. But I mean, you have different labels and it's set up. You just put your patient in and print your label and it just spreads on the package. It's got the patient's name, the date, and every medication and strength on that one little tiny cup. So nice. It's all there. Yeah, it's all there. It's not all, a bunch of pills with a bunch of labels on. It's it's neat. It's professional looking. And
Very
I
cool.
really haven't seen many others because I'm so impressed with this. It's just totally professional looking.
Yeah, yeah. There's, like I said, a lot of different options out there. So I always like to hear, which options, pharmacies have found that really fit their needs, because there's, again, so many different formats, and there's, benefits to all of them. So, you mentioned that you have another pharmacist on board now. So, you have a little bit more time, which is always great. As an independent pharmacist, you're the building manager sometimes, the, delivery driver, the janitor, the you
Oh,
name
yeah.
it.
Yes.
So with this newfound freedom on your schedule, hopefully, what are you looking forward to? I know there's PQA has some new diabetic measures that they've rolled out recently. Do you have some clinical goals that you're focusing on, or are you going to focus on community?
I would actually like to start helping other pharmacies in my
Yeah.
spare time. Just a couple of days, a week. It wouldn't take long, just let me go in there. I'll show you where to start and then turn you loose after that. Just, learning that Equip dashboard. It's simple. And I mean, I would love to do stuff like that,
Yeah, that's really that higher calling where we see pharmacists, I love, it's like, I've got to coin like a term for it, but, it's like that fourth level that, you go from the, working in a big box retail environment to an independent to ownership and multi-store. And then there's that next step. And a lot of times that can be like precepting or, working with groups like NCPA to, just kind of help push legislatively. And then, we see those pharmacists that move into, mentoring and helping other pharmacies.
Yeah, because these high volume stores, they're leaving thousands on the table.
Yeah.
Thousands.
Yeah, it's crazy to think, because, you can see where in some areas, you might just look at your reimbursements and say, oh, well, I could submit a different NDC on that claim, or, there's a DIR fee for that, and I understand that. But a lot of what you're talking about is way down the road. So you're not seeing that immediate response. You really have to be proactive. Look at your scores, look at those leading indicators to figure out your financial stability 2 years from now.
Exactly. As a matter of fact, from 2019 to 2020, my variable rates, I went up 500% on my reimbursements.
Wow.
And I'm a low volume store, so imagine somebody doing 400 a day.
Yeah, so you're, 100, 150 scripts a day probably?
Yeah, COVID knocked me down. I was 150 last year. It kind of went down with COVID. It's coming back up again, though.
Yeah, that's
for two people.
Yeah, no, for two people, especially taking a really hands-on approach.
Right, we're not just filling and we're doing it all. So yeah, but it's doable.
Yeah,
it is doable.
Yeah, you mentioned script count has taken a dip with COVID. Do you see any bigger ramifications from that? Maybe people avoiding the hospital, avoiding, going to the doctor, avoiding going to the pharmacy?
No, I think what it was is when we had all these, I don't know what you call it, lockdowns or whatever last year, people weren't going to the doctor as much because they were doing more telemedicine. So people were just not coming in.
Yeah.
But that's picked back up. I'm just reflecting back on last year.
Yeah.
It's picked up. It's coming back up.
Yeah. What do you expect for the flu season? I figure this year might be kind of interesting. I know everybody's been locked up. So.
Well, I really don't know what's going on. And I might be considered a conspiracy theorist if I go on this conversation. So I didn't feel any Tamiflu last year, so I don't know.
Yeah, isn't that wild? But I guess, everybody stayed indoors, everybody washed their hands, everybody wore a mask. Surprise, nobody got the flu. So, okay, maybe it works. But then now my daughter went back to, she's in third grade this year, and she went back to school, and a weekend, I had some back to school bug that she brought home. I'm like, yeah, I have no immune system anymore. I'm just going to catch every cold, every bug that I can. So.
You need your zinc, your vitamin D. Come on, man, I'll get you on a regimen. Because I'm taking zinc, vitamin D. I've always taken a Super B complex with C. I've never gotten sick. I don't get sick. Really, it's crazy.
Yeah, I'm also like, if I get the slightest cold, I get the what you may have heard of as a man cold.
Oh, yeah.
Yeah, like I get a little bit of a cold and I limp. Like,
well, and it's scary now because, with the pollen and everything in Louisiana, it's like, oh my God, do I have COVID? What's going on? I'm sneezing. It's like,
oh yeah, yeah.
It's kind of a scary thing.
So hopefully things are kind of returning back to normal a little bit in some ways. I feel like I hate that a new normal is like a term that we use, but it kind of seems like, there's some familiarity with the situation and we're moving forward, put it that way. So what do you see coming down the line that, outside of COVID, what were we focusing on with metrics, with PQA? What's still important? What's maybe important that wasn't important before moving into the next year?
The opiate problem. We need to, watch that. I think that's going to be coming down the pipe with EQIP. Mental health. I forget what insurance it is, but one of them's focusing on mental health now. Humana. For one thing, I do have something I need to do with a few patients for Humana, but I can't remember. There was someone else. But yeah, again, keep up with your MTMs because that's a good, another thing. Check it weekly at least because they warn you who's coming up for refills that you need to, they'll give you a heads up. And again, you take care of that, that's $10. So let's just say you're only making $2 on it when you fill the medication. They're giving you a heads up, hey, he needs his medicine filled. And if it's all three, your metformin, that's $30.
Yeah.
They're going to pay you just for making sure he picks it up.
Yeah. Where do you find your MTM information?
Well, mine is through Outcomes.
Okay.
Yeah. So if you're not following that, they'll tell you when you sign into it, you've got a chance to pick up $4,000 with CMRs.
Mm-hmm.
And if you don't do it, somebody else like me will pick them up.
Yeah, because it sounds like you're really doing like many CMRs anytime you get a refill request anyways.
The patient's here to pick up the medication. Perfect timing to let's go over your meds with you.
Pharmacists are forever saying we want to get paid for, the clinical work that we're doing, the services that you're providing. MTM says, hey, we'll pay you.
Yeah, all you got to do is do it, And of course, it's and I can't say anything because I've been a pharmacist for 33 years. That makes me an old school pharmacist. Counting is, typing, that's what we've done. But you've got to adapt. You've got to evolve. If you want to be a healthcare provider, and what if we would just get that status finally as a healthcare provider status? That would be immensely great for us, for our profession. But we've got to prove to them that we can, CMRs is one way to do it.
And that's another neat thing that I think is going to come out of the COVID pandemic is that pharmacists had to step up. Pharmacists had to provide some of those services.
Right. And that's a lot of stress.
And if you're providing point of care testing, if you're providing immunizations, if you're writing prescriptions based on point of care testing, like really kind of move the needle forward, hopefully. So
that's right. That would be a fantastic thing for us too.
Yeah. Well, I know that it's only you and Nikki in the pharmacy today, or is your relief pharmacist
Well, I
there?
have Megan. Megan's there.
All right. All right. Well, good. I'm going to let you get back to the team. Thanks so much for joining us, and want to talk to you soon. Hopefully, hear about your exploration into helping other pharmacies. So, countdown. Let's give some bullet points, some homework for anybody listening. Go sign up with the Quip.
Yes.
Make sure you're not.
Yeah.
Yeah. You gotta be aware.
Yep.
Make sure you're getting those MTMs.
Right.
Make sure you're focusing. MedSync. What else? What else pharmacies need to be doing this year?
Focus in on packaging patients that you just cannot pick up monthly, and change to Pioneer software.
I'm not going to argue with that, but I didn't make you say that.
No, you didn't, but I threw that in for sure. No, because
Okay.
it's the best reporting system ever.
Yeah.
I mean, you have it all. And my God, there's so much I don't even know about it. That's another thing. I'd like to go spend a day with someone and just like, hey, show me what to do. You know, there's so many things that can be done that I'm not even using.
Yeah, for sure. I need to dive into your system and kind of have you show me some of those reports, and maybe we can have you come in and do like a webinar soon, kind of share some of those.
That would be awesome. Great. Love to do that.
All right, well, I'll let you get back to it. Thanks so much for joining us, and we'll see you soon.
Thank everyone at Pioneer, because the response anytime I need help is immediate. I have no problems at all. And just peace to everybody over there. Y'all are great.
Awesome. Thanks so much. Shout out to all the Pioneer support. I love when we get those unsolicited compliments. I didn't make you.
Nope, did not make me at all. Did not make me at all. But thanks so much for having me. I appreciate that.
All right. Talk to you soon.
Okay. Bye-bye.
Thank you for listening to this episode of Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.